Super. Okay. Hi, everyone, and thanks for joining us today. My name is GJ Melendez-Torres. I'm an epidemiologist at the University of Exeter. I'm also the co-director of the NIHR Research Support Service, Special Center for Public Health Southwest Satellite. So that's quite a lot. As you can tell from the name, we're based in the Southwest, but we work closely with Newcastle University and partners to deliver the Special Center for Public Health. And so today's webinar is about research inclusion. It's a topic that I'm very passionate about. I will start by talking a little bit about why this is relevant in the context of NIHR funding as a general point, but then I'll move on to what I think is a really important bit, which is how we can take several steps to improve research inclusion in the research we do, the research we plan, and the research that we hope to get funded. At the end, we'll have time for questions as well. So NIHR's mission is to improve the health and wealth of the nation, as many of you will be aware. And one of the important ways that we do that is by reducing health and social care inequalities. Now, these inequalities are important because they tell us something very useful around who has good access to care and health services, who has good access to public health services, and who's being well served or not being well served by the services that are currently available to us. So one of the things that we then have to think about is how can we design our research all these points. Now, one of the things that we know is that research is not currently serving those most in need. The people who participate in research aren't those who need research the most. For example, heart failure is something that predominantly impacts older adults, including older adults from ethnic minoritized backgrounds. The participants in heart failure research are 20 years younger than patients. And participants in diabetes research are not ethnically diverse, despite the major inequalities that we know exist, for example, with respect to South Asian populations in respect of diabetes. So there are a number of reasons why this is challenging to us. One of the reasons why it's challenging is that the benefits and the side effects of research may not translate to real-world populations or settings. What I mean is that what we find in the evidence doesn't actually tell us very much about how it's going to work in the real world, in the kinds of diverse places and spaces where we work. By relation, new treatments, services, or initiatives may not be deliverable or applicable to all groups. Important findings specific to different populations may be overlooked, and this culminates in health inequalities being maintained or even increased as well. And this is because research is not being designed and conducted in an inclusive way. So one of the things that NIHR talks a lot about is inclusive research, specifically research inclusion, and what it means to do that across the life cycle. This is really important because research inclusion is not a one-time event. It's not a thing that happens in space and time. It's an idea and a perspective that we carry with ourselves throughout the entire research process, from idea development through commissioning all the way to publication and impact. So at each step of the research process, we should be using an inclusion lens to understand what it is that we are missing and what it is that we could be doing better to ensure our research has the best chance of having the best impact for the most people. One of the really important ways that we do that is by ensuring effective public and patient involvement, or as we like to call it in public health, community involvement and engagement, but also thinking around knowledge mobilization and listening carefully to the people who are most affected or who stand to benefit the most from the research that we do, to understand how we can help the research get to them and to the people who care for them directly. Now, something that we like to think about are what are the 10 steps to inclusion that you can take across the research life cycle. So here are some of them. The first thing is that it's important to couch your approach to inclusion in terms of substance. This isn't just something that we can wade through as a nice idea. When your application goes to a funding committee, particularly an NIHR funding committee, people will be reading your application with a lens towards inclusion. And so what you want to do is ensure that you can substantiate your research inclusion statements in terms of past experience, in terms of existing relationships, in terms of the kinds of relationships that you know you will need to build to deliver your research in an inclusive way. Importantly, this includes your research team being skilled enough and diverse enough to carry out researcher inclusion. One of the reasons why we like to see public co-applicants on funding bids to NIHR is because that's an important but not the only way that we know that research inclusion is being supported in the context of your work. One of the main challenges that comes in research inclusion is recruiting from underserved groups. How is it that you know that you'll be able to do that? Have you developed the partnerships that you need with community organizations? Do you have the standing programs that you need to have in order to ensure that you're recruiting and delivering appropriately? So the first is to substantiate your research inclusion statements, drawing on your expertise and your knowledge from across your team and also from your local region. Important and related to that, you want to ensure that you know which inequalities are relevant to your field. This is often a really good opportunity to work with your local public health intelligence teams, as well as with your local director of public health's office. Often Director of Public Health annual reports will tell you something really useful around the kinds of inequalities that are understood as being really focal for your region. So one of the things that you want to think about is not only the inequalities in terms of the health burden in your local area or where you're hoping to do the research, but also inequalities in terms of the research that currently exists. Are there certain groups that we want to know more about that are currently highly underrepresented or even just underrepresented in current work, and for which we would like to have specific and focused knowledge in order to better reassure or provide better knowledge about what we can be doing to support better public health for those groups? One of the things as well that I would encourage you to think about is how you can include health or care inequalities in your research questions, both in terms of how you design your research, but also in terms of thinking creatively about how you can involve different kinds of groups or different people in terms of delivering the research that you know will be the most impactful for where you are locally. Something else to think about is how you can include areas underserved by research in your study. Justify your choice of sites. And again, this goes back to my prior point about thinking around the intersection between the areas that are of interest to you, the areas where you are, and what the public health intelligence and policy priorities are with respect to local inequalities. If you're doing work across multiple local authorities, one thing that you can do is also think around setting up or taking more time to set up in less research sites. Some local authorities will be ready to go. They'll have been working closely with HDRCs or the Health Determinants Research Collaborations. They will know a lot about what they need and what they want to do in order to get research happening. Other local authorities may be less ready to do that. And one of the things that you want to do is make sure that you're bringing along all local authorities for your conversation, all the local authorities along on your research with the goal of including areas that may be less research ready. Excuse me. This is what happens when you teach undergraduates. Even academics are not immune from the freshers' flu. So you want to consider working with local authority networks like the Local Government Association and Health Determinant Research Collaborations, and engaging with the broader NHS tools that are available to you. You can also think about working with your regional research delivery network to develop some real expertise about how to work across a wider range of local authorities than perhaps the one that you know, or the one that is the most research ready. Another thing that we look very carefully about is how you will justify your research sample. Have you specified exclusion criteria that are justifiable and that don't make inequalities worse? For example, by excluding groups who would really stand to benefit the most from this work. One of the really key clinical examples that we often look at, which is less relevant for local authority public health, is that many clinical trials, for example, exclude women who are menstruating or who are currently pregnant. And so one of the challenges with that is that we then lose a lot of information that could be very useful around how these interventions impact or how health interventions impact women across a range of experiences. So you also want to think around if you will need specific services, skills, or devices to make sure people are included, and how you will capture the diversity characteristics of your sample. For example, if you know you're going to be working with a population for whom English is an additional language, well, you need to ensure that you have the kinds of interpretation and translation services ready to ensure that you're meeting everyone's needs. An important point that's related to this is that you want to specify which demographic data you will collect and how you plan to use it. In my experience, and I think in the experience of most researchers, people are usually willing to provide these data if they understand why and how it will be used. You want to make sure that you are consulting carefully with public involvement colleagues around the terminology that you're using. And you also might want to consider using this demographic data to support subgroup analyses to ensure that interventions are equally effective for everyone, and similarly for qualitative studies to contextualize the analysis. Something that people often forget, but that funding committees certainly have a very clear eye on, is budgeting for inclusion. You want to specify all costs for inclusive research and justify them. For example, if you said that your sample includes a very high level of people with English as an additional language, but you're not budgeting for translation or interpretation, that will be picked up. So one of the things that I think NIHR is doing is that they're also recalibrating what it means to deliver value for money in terms of the research ability to address inequalities as well. So you should meet that where it is and think around how you can better factor in cost and time implications of delivering research that is genuinely inclusive. Something else that's a bit of a nerdy point, but one that I would encourage you to think about, is how methodological innovation can overcome some of the aspects of conventional methods that are exclusionary. A lot of qualitative research relies, for example, on semi-structured interviews, but that presumes a certain ability or desire or comfort with oral fluency, predominantly in English, that not all people may have. It also presumes that academics, for example, are able to bridge that divide. Something you might consider doing is thinking around participatory and creative methods, working with peer and community researchers, and community-based recruitment, and thinking as well around different methods of collecting data across a range of research designs that you might be using. Something that I think underpins all of this is effective, diverse, and inclusive public involvement and engagement and community involvement and engagement. If you don't start by engaging diverse groups, you're going to have a really hard time ensuring that your research is inclusive. One of the things that I think is difficult about this is that a lot of standing user groups really oversample from people who are already doing pretty well from a privilege perspective. So something that I think is really worth your time is thinking about how you can listen to all voices about your research to ensure that you're really getting all of those views in the conversation as early as possible. And at the tail end, thinking about knowledge mobilization or how we get information out the door in order to support people to do a more effective job at taking up the research that we produced. Knowledge mobilization and impact plans are essential and should include diverse groups from the outset, both in terms of including diverse groups in your planning, but also and importantly, thinking around how your message will reach diverse groups. The key messages from your research need to be useful, impactful, and accessible to relevant people, networks, and communities. And that will often require some really careful involvement and engagement to ensure that you're delivering that. So thinking around the pathway to impact is going to be useful, and you can include health and social care inequalities as part of that. And my final point is that there are a range of toolkits available to you, including support from the RSS, such as ourselves, to support you in thinking carefully about this inclusion aspect of your work. So don't be shy, get in touch, and we'll do our very best to help you out in terms of thinking through some of the research inclusion implications of the work that you're hoping to do. So thank you very much for joining us, and I will be very happy to answer any questions you may have at this point. So please feel free to add questions in the chat or unmute yourself, and we will take up any one of those as we go. Farha.
Hi, so I was just wondering, when you were talking about translation services and everything else, is it okay to include how is it all right if I speak the languages and I do the translating and everything else, or how does that
Yeah,
work?
that's okay, but that's often a stretch, right? And so if you can do the interview in your original language, as long as your ethics board signs off on that, that should be okay. You will still want to think about how you get that translation done.
Okay. Yeah, it's
Because
just
importantly, sorry, just to add on to that, it's not just about the interview. The consent forms should also then be in the language that you were hoping to do the work as well. So it wouldn't be very inclusive, for example, to give someone a consent form in English, expect them to sign that and then do the interview in their mother tongue, such as it might be. So you still want to think around the translation of your key study materials to ensure that you're reaching everyone.
Okay, thank you.
Okay, and yes, Claire, we will circulate the slides in the coming days. Okay, any other questions? Mohammed, please.
Um, some communities may have languages that are spoken only. So I'm thinking about the majority of the Pakistani Punjabi community, for example. The Punjabi is just a spoken language. So that would then create a problem of ethics that if you are to provide something in a written format, language, well, they won't be able to read it anyway. So how might we get around that?
So I think that's a good question. So it's not strictly a problem. You still want the consent materials, or you still want to agree a script for how that consent will go. And so we have experience. For example, I've done a lot of work into partner violence. And when we're interviewing survivors, it's often unsafe to send postal materials to their homes, right? And so in that situation, we take oral consent, right? And we record that so that we have a record that consent was provided orally, and then we write that into our ethics application. So I think for that point, that's a really great point. Thank you, Mohammed. You still need to make sure that you've agreed what the script is going to be so that consent is done in a systematic and appropriate way for all your research participants. Does that answer your question? Great. Okay, thank you for that really nice question. Any other questions? Lorraine, are there any step-by-step guides / checklists for ensuring good research inclusion at every step? Yes and no. So some of the resources on the last slide I think are quite useful in supporting you to think about it. What I would suggest to you is that this is where really effective involvement and engagement comes in, as well as ensuring that you carry that through your research project. One of the things that I would stress to you is that I think there's a really valuable role in thinking through research inclusion from the outset, so that it's not something you necessarily have to think about new at every step, but almost planning for how you're going to plan to do that research inclusion as well. When we circulate the slides, we will ensure that you have this, that you have access to those resources as well to support you in thinking through that. Okay, great. Thank you, Lorraine. Sarah, you have asked, what do you see as the role of research governance in promoting research inclusion? In particular, how can HDRC research governance officers ensure that inclusion is effectively captured within the processes, especially in the context of a local authority? That is a great question, and usually when someone says that something is a great question, that means they don't have an answer for you. So that, I think, is a really good point. I think what I would say to you in this context, right, is that it's more around having a standing process for what your expectations are for research inclusion in your research. And one of the real benefits that you have of being in a local authority is that you can think very carefully around the kinds of inequalities that are likely to be very important for you in your local authority context specifically. So what I would probably think about doing is, can you co-produce some local standing expectations for how research inclusion will be considered, and how you will ensure that all research as it's approved meets those expectations as well. One of the things, of course, that's tricky is that it may or may not be your role to work with research across the entire life cycle as opposed to manage that portfolio. So I think that's a question for you locally to think around how you ensure that you're blending those local expectations with also what is specific for how your HDRC is organized. Okay. Vicky, yes, inclusion can be costly in time and money. So absolutely early on, you want to make sure that you're planning to plan here. Okay, Karina, you've been waiting patiently and politely with your hand raised.
Which is quite unusual for me, so that's great. Thank you. That was really interesting. Thank you. So I lead a clinical doctorate program, and students whose research is not funded, and they're doing it alongside full-time clinical roles, and so they're very time poor and money poor.
Yeah.
And I'm just wondering, what do you think at that sort of doctorate level, single researcher, generically, what are the most important things to at least try to get done in terms of inclusion? I know that that's project specific and is going to be difficult to say.
I mean, I think you kind of answered your own question, right? I think it will be difficult for me to say these are the top 5
Yeah.
things that you must do. I will tell you things that are generally real clangers for us when we read applications
Yeah.
with an inclusion view, right? Which is materials that are inaccessible, okay? Data collection methods that don't actually meet the needs of the population, and inclusion and exclusion criteria that unfairly exclude groups that would stand to benefit from that research. So I think if you address those points thinking early on, and keeping in mind as well that the scope for knowledge mobilization in doctoral research can often feel a little bit tighter, or may happen differently because of course they're in a practice placement. I would say that if you start with those things and kind of see where that journey leads you, I think that might help to orient the research in a way that's more inclusive.
Excellent. Thank you.
Okay, my pleasure. Okay, has anyone ever used AI for translation/interpretation purposes, or is it best to go with more traditional services? You know, that is very tricky. I just don't have an answer for you on that. I think I would need to be very reassured about the privacy aspects of AI used for translation and interpretation, particularly because unless you know the provenance of your data and where your data are going, I think that could create additional ethical challenges for you. I also just don't know that all AI services are created equal in terms of their quality. So I think I would approach that with caution, is what I would say. Okay. Any other questions? We have time for 1 or 2 more. Okay, going once, going twice.
GJ, I wonder if it might be worth addressing the point about you saying how important it is to ensure that you're building links with communities from the outset, maybe prior to doing any research and that kind of thing for people that are very, very new in their journey.
Yeah.
What kind of things can people be doing to facilitate that?
So I think building those links is key. One of the benefits of being based, especially in a local authority setting, is that some of those links will be closer to you than otherwise. So there's no really one right way to do that, but I think the key is to do it early and to do it well, which I realize is a bit of a non-answer. I think what I would just add to that as well is that it's better to do this right than to do it fast. I think for the vast majority of the research that we do, I can think of very few situations in my research career where I've had to do something at warp speed, and all of those were to do with COVID, right, in lockdown 1. So I think in a broad sense, it's better to do it right than to do it fast. And there is, I think, an important room to think more broadly about how you pilot research to ensure that you're capturing the process points that you want to be capturing as you do it. Okay. Any other questions? Look at that, bang on time. Okay. Thank you everyone for joining us. We will ensure that those slides are circulated in the coming days. And it's been a pleasure to talk with all of you. Hi, Susan Hamshaw. Oh my gosh, did not see you there. Lovely to see you. Unexpected friends coming into the chat. If I had known Susan had been spying on me, no, I would have said the same thing. It was good to see all of you. We will ensure that the slides are circulated and have a good rest of your days.